When I was a resident and someone got the diagnosis of ulcerative colitis, we used to tell them it's not, you're going to just take medicine, you're going to end up with surgery. But today, the good medicine they're giving for ulcerative colitis is putting a lot of surgeons out of business because they're healing it pretty well. But still, there is a few. Somewhere along the way, you might have to do something for ulcerative colitis. If that's the case, what does a surgeon do and why?
When a patient presents with ulcerative colitis, you have to figure out how sick they are, and you have to identify the medications they're on. The end point of all of the surgical procedures is that we remove the whole colon and bring the small intestines down towards the anus, creating a pouch or a reservoir that can recover the function that the rectum provided, which is to serve as a capacity area for storing stool.
At some stages, they have to wear a bag for a while.
If a child is extremely sick when they come to see us, or they're on very strong medications, we want to stage the operation. And oftentimes the first operation entails removing the whole colon and giving the child an ileostomy. As they recover, since the colon is out, which is the cause of all of their problems, the medications that have been suppressing their immune system can be gradually weaned off. As this occurs, the child can gain strength, start to gain weight, and become healthier, and tolerate the second operation, the reconstruction, much better.
If you do the surgery, does that cure the disease?
Surgery is curative for ulcerative colitis, yes.
Is there also a risk with ulcerative colitis that if you leave it in, there is an increased risk for sometimes developing cancer of that area?
Absolutely. Ulcerative colitis is an inflammatory condition that's chronic and repetitive, and these are problems which predispose you to forming cancer, and there's a significant risk which continues to increase throughout life while the colon remains in place.
You say a 1% increase per year after the age of 20, 25?
Correct.
So if you can't be managed relatively successfully, that's something that you should be considering down the road, the surgical repair?
Well, if you can be maintained and controlled as a young child or adolescent, then yes, you can potentially delay the surgery. But at some point in your late teens or early 20s, many people recommend the operation in order to avoid the potential for cancer formation.
These medicines, they do have a lot of side effects they use. So it's a risk-benefit ratio.
Correct.
So you just can't handle the medication, and they're not doing such a good job, you have at least another option.
Mm-hmm.